Hello, ladies and gentlemen. Welcome to Health Life 360 LLC. I am Dr. Nik Nikam, and let's talk Medicare. Medicare A, B, C, D, alphabet soup. And more importantly, let's talk about Medicare Advantage plans. The feature presentation is going to be Medicare Part C, or also known as Medicare Advantage plans, which incorporates Medicare A, Medicare B, and Medicare D, along with a number of other features. This presentation has been brought to you by Health Life 360 LLC. So let us begin with the feature presentation. Health Life 360 is an insurance marketing organization licensed in health and life insurance fields for more than 25 years. Specializes in senior healthcare insurances and under 65 individual and group health plans. Today's agenda is to get an overview of Medicare Essentials, 2022 Medicare changes, Medicare Supplemental plans, 2022 Medicare Advantage plans and their highlights, 2022 Medicare prescription drug plans, and finally question answers. If you're close to 65 and you're eligible for Medicare, you enroll in Medicare Part A and Part B. You get a card like this called the Medicare card, which will have your name. You have a member ID, and it will say whether you have hospital Part A, which most people will have, and medical, which is Part B. Hospital part is the one that pays for the hospital services. Medical part B is the one that pays for medical services received in doctor's offices or when you get x-rays and other tests. Even if you switch over to Medicare Advantage plan, you're recommended to keep your Medicare card so that in case you change over to Medicare from an Advantage plan, then you have your Medicare already available. Medicare insurance is like an alphabet soup. We got Part A, Part B, Part C, Part D, MEDIGAP, Supplemental insurance, Medicare Advantage plan, HMO, PPO, point of service, PFFS, MAPD, and PDP. What do all these things mean? Don't worry, we will try to resolve all these things step by step. First of all, Medicare Part A is the hospital insurance. It pays for services rendered in a hospital setup or in a skilled nursing facility or for hospice services and some home healthcare services. Part B is the physician part, as it is generally called. It pays for the doctor's visit. It pays for the medications given in doctor's offices and vaccines given in doctor's offices. It pays for the x-rays, tests, blood tests, and all the other ancillary tests that are done. It also pays for outpatient medical equipment. Part C is the new form of Medicare service, which incorporates Part A, Part B, and Part D. We didn't even talk about Part D, so we're going to talk about Part D now. Part D is the prescription plan, which is part of the Medicare system. The Part D is administered by private insurance companies, but it is something that you have to have if you have Medicare Part A and B in order to pay for your prescription drugs. If you don't get the Part D right when you get your Medicare Part A and B, later on you may have to pay a penalty to subscribe to Part D prescription plan. MEDIGAP. MEDIGAP is something that's been around for a while. When people basically had Medicare Part A and Part B, there was what was called a supplemental insurance, which covered what Part B and Part A did not cover. For example, hospital deductible. When you go to the hospital, Medicare Part B, 20% co-insurance pay, which you have to pay for doctor services, and many other things like that for x-rays, MRIs, medical equipments, and ancillary services, supplemental insurance would come in and cover those expenses. And there are a number of supplemental policies which we are going to talk about during this presentation. Important topic for today is Medicare Advantage plans. Medicare Advantage plans are sort of a hybrid form of an insurance which is administered by private insurance companies like Blue Cross, United Healthcare, Aetna, Cigna, Humana. Most major insurance companies offer this, including local clinics like Kelsey Sibo plans. And they come in different forms like HMO, PPO, point of service, PFSS. Yes, what do these mean? We will explain to you in a minute. The question is, which one do I choose? How do I know what is right for me? When do I sign up? Where do I sign up? Who do I talk to? These are all very relevant questions. I talked about Medicare Part A, the hospital part. We talked about Medicare Part B. Then I talked about MEDIGAP, which is the Medicare Supplemental Insurance, and Part D, which is the prescription drug. But Medicare only covers Part A and Part B, while the other two are through private insurance companies. Whereas Medicare Part C is a combination of Part A, Part B, and sometimes Part D. So all these put together, the insurance company will provide you with the coverage for the hospitals, for the doctors, and also for the prescriptions. In addition to those, it also provides certain ancillary services, which I'm going to talk in a minute. Why do we need to change from regular Medicare Part A and B to Medicare Part C? There are a number of reasons why you may want to choose Medicare Part C versus a regular traditional Medicare Part A, Part B. An important thing to keep in mind is when you have regular Part A and Part B, you also may need to have a Medicare supplemental insurance to cover some of the copays. Plus, you also need a Part D prescription drug coverage to cover for the drugs. If you don't get the Part D in the initial period, then you may have to pay a penalty. Whereas with the Part C, all of these things are covered by the private insurance company, which has contract with Medicare to provide all these services which Medicare would have otherwise provided part of it, and where the private companies would have provided part of it. Whereas here, all of them are handled under one roof, like Blue Cross or United Healthcare or Cigna or Humana. They take care of all the expenses related to Part A, B, and D. And that's why it is an Advantage plan. So let us explore more about this Medicare Advantage plan. Medicare Advantage plan, as I told you, it incorporates most of the cost involved with Part A, Part B, and Part D prescription plan, and much more. What is this much more? Let's see that one. There are a lot of services that are not covered by Medicare, the traditional Medicare. It doesn't cover eye exams. It doesn't cover dental. It doesn't cover hearing aid and things like that. Whereas Part C, the Medicare Advantage plan, can cover, as you can see, 79% of the people have eye exam glasses, telehealth, dental benefit, fitness, gym, hearing aid, over-the-counter drugs, meal benefits, transportation, safety equipment, and in-home support. So there are a lot of ancillary services that are provided by the Medicare Advantage plan, which would have costed you quite a significant amount of money if you needed those services. Whereas if you are with a Medicare Advantage plan, you would have all the services covered by the plan. That's why it pays to shop around and see which plan best suits your personal requirements, which plan suits your medical conditions, which plan suits your medications, which plan suits the doctors who are in your network or people who are currently addressing your medical problems. All these things are important. And let's talk about the various types of Medicare Advantage plans that are provided by most of the insurance companies for that matter. First one is the HMO, Health Maintenance Organization. That is like the basic bare bone plan. And most of you are familiar with the HMO, where you have one or more counties which are involved in the network. It's most common Medicare Advantage plan, and you have to have a primary care doctor. You need referral from the primary care doctor to see specialists. You have to go to a specialist in the list. You have to go to the hospitals that are listed in your network. When you go out of network, you may incur extra costs unless you needed emergency services. The PPO is like a preferred provider organization. It is also a network of Medicare recipients and providers, primary care doctors and specialists. They all belong to the network group. As a result, if you need to see a specialist, you don't need a referral from the primary doctor to the specialist. You can go and see the specialist and simply call their office, set up an appointment and see them. That's one advantage with the PPO group. Number two, you can see even doctors outside the network, but when you see doctors outside the network, obviously your copay is going to be quite substantial. You don't need referrals. When you go out of network, you are going to incur maximum out-of-pocket costs. We have a regional PPO, which is like a larger network. If a local PPO is like something like that covers the south part of Houston, and the regional PPO may be something that covers the entire state of Texas. So wherever you go in Texas, you can find doctors in the network who can serve you and the hospitals in the network. This may be very important for some seniors who have one kid in Dallas, one kid in Austin, one kid in Houston, like I do. Then it may be helpful for you to pick a PPO that is regional, so that when you go and visit your kids, you are still covered by the same insurance company, so you don't have to incur out-of-network costs. Of course, again, you don't need any referrals when you're dealing with a PPO. The preferred fee-for-service plan is something which is almost like a regular Medicare and Medicaid Part A and B insurance, except that you are in a Medicare Advantage network. You can choose any doctor outside to see, and however, the doctor has to accept the insurance. If the doctor doesn't accept the insurance, then you could incur extra costs. There's no referral needed, but again, you are going to incur costs because it is fee for service and you're seeing doctors of your choices. Which one do you choose? I think it depends upon which one of your doctors are in the region, in the networks, and how much flexibility do you want. Do you want to join an HMO and be restricted to see only doctors in that particular group and have a referral for everything that you need to do in terms of seeing a specialist or getting a CT scan or an X-ray or an MRI? Those are some of the things you have to look into. Whereas having a local PPO may be more economical, but if you go to a regional PPO, it may help you to have a broader coverage and has more options available if you travel 6 months in one state, one city, and 6 months in another city. That's where I think the regional PPO may be a better choice. And if you can afford, you can have a fee-for-service arrangement. But again, you have to concur with the doctor that they are willing to accept the payment from a Medicare Advantage plan. Unlike a Medicare Part A and Part B. Even Medicare Part A and B, some doctors don't take Medicare at all. So it's best to check with the doctor you're planning to see. MEDIGAP and Medicare Advantage. I showed you in the initial slides, we had Medicare Part A, Medicare Part B, prescription drugs, and MEDIGAP. MEDIGAP covered all the deductibles, coinsurance, and copays, which were not covered by Medicare Part A and Part B. It may not cover prescription drugs. That's why even if you have MEDIGAP or supplemental insurance, you still may need a separate prescription plan to cover for your prescription drugs, because if some of the drugs could be quite expensive, like for a blood thinner could be like $300 to $400 a month, or a new heart medication could cost you like $600 a month. Same thing with any cancer treatment. So that's why you do need a prescription plan no matter which route you go. Whereas Medicare Advantage plan has several advantages. With Medicare Advantage plan, you need to be eligible for Medicare Part A. You need to be paying your Medicare Part B premium. These are the prerequisites to be able to enroll in a Medicare Advantage plan. And the advantage beyond that is Medicare Advantage plan may be not costing you anything at all, including all those ancillary services plus regular Medicare and Medicaid coverage, and maybe even some prescription drugs depending upon your income and your needs. They may have a small premium if you ask for extra services. So they may be lower premiums, but they do have co-pays. You may be restricted to the network. You may need referrals, especially if you belong to an HMO group. But you do get these extra benefits like vision, hearing, fitness, home services, the premiums and deductibles for Part A and B. So this is the traditional Medicare I'm talking about now. The premium for Medicare Part B for 2022 is $158.50. This is the Medicare Part B which you have to have in order to continue with your Medicare Advantage plan. That's why it's important for you to pay attention to this particular chart. The premium deductible is $198 to $203, and the hospital deductible is $1,400 to almost $1,500, and it could be a little different for year 2022 because these numbers have not yet been released for year 2022. Okay, here's another important thing I want you to keep in mind is that if you're still working while you're getting your Medicare and you're paying for a Medicare Part B premium, keep in mind that if your income is greater than $88,000, if you're filing individually, and if your joint income is $176,000 or less, you pay $148. This is 2021. But as your income goes up, your Medicare premiums, Part B premiums go up almost $100 per $100,000 increase in your gross income. So that's something you need to keep in mind, because that money is going to be taken out of your social security. So you don't have too much, you don't have choice. You don't have a choice. Social Security Administration's COLA, that is the cost of living adjustment for 2021. We don't have the data for 2022 yet. It may be slightly higher. We just have to wait and see. Medicare Advantage plan also introduced telehealth services in 2021. As you know, we had this big pandemic where everything was shut down, but the doctors still needed to continue to work and the patients needed services, which introduced the telehealth service for important visits so that patients could be seen, their medications can be renewed, and their acute medical problems could be addressed. So there's telemedicine services were offered in many specialties like dermatology, primary care, psychiatry, gynecology, cardiology, endocrinology, and these number of services are continuing to increase each year. And of course, the telehealth is going to be here for a long time, and some of the visits may even replace the traditional office visits in situations where a lot of these can be handled through the audio and video conferencing. Let's talk a little bit about end-stage renal disease. As you know, most end-stage patients with end-stage renal disease, whether they're on dialysis, as you know, most end-stage renal disease patients are on Medicare. If someone has an end-stage renal disease and has been on dialysis for like 4 or 5 months, they automatically become eligible for Medicare. As of January 1, 2021, Medicare Advantage organizations are no longer responsible for organ acquisition costs of kidney transplantation. The costs will be eliminated from Advantage benchmark and will have coverage under a fee-for-service program instead. Most of the patients with kidney problem end up on regular Medicare Part A and Part B and supplemental prescription plan, which will be covered by some sort of financial assistance to these patients. Another significant change to the Medicare Advantage plan is adding long-term care stays up to 190 days. The Advantage plan premium costs may be going down by an estimated $21, something we just have to wait and see. The Medicare Advantage plan also provides insulin coverage for patients with diabetes. As you know, in 2021, the cost of insulin was skyrocketing, for which Trump introduced a bill where they regulated the cost of insulin, especially for Medicare patients, and that advantage is available to even those patients who are on Medicare Advantage plan. Let's talk about enrollment. When do you enroll into Medicare Advantage plan? What if you don't like the Medicare Advantage plan you have? Can you get out? Can you switch over to a different Medicare Advantage plan? What happens when you change your job or something else changes in your condition? Can you enroll in a Medicare Advantage plan? So we have answers for all those questions. We have an annual election period that is between October 15th and December 7th. That's when people can enroll into an Advantage plan. Then we have the open enrollment period, which is from January 1st to March 31st. Then we have special elections period, and we'll talk about that. The annual election period is starting from October 15th, which is coming up in a few weeks, and it goes up to December 7th. And any new Medicare Advantage plan you select during this period will be effective on January 1st the following year. Let's say October 20th, you select the Medicare Advantage plan XYZ, and your existing plan will switch over to XYZ on January 1, 2022. So that is the annual election period. This is when you look at all the features you have, look at what your needs are going to be for the coming years, and see if your doctors have changed, and if some services have not been renewed, then you may have to look at other plans. Hence, it pays to review your Medicare and Medicare Advantage plans every year in the month of October, the first 2 weeks of October, and see what things have changed and how your coverage is going to be affected and what are the alternatives available so that it meets your requirements based upon your doctors, your medications, your hospital services, and of course your financial situation. During the annual election period, you can change from original Medicare to Medicare Advantage plan, return from a Medicare Advantage plan to regular Medicare, switch from one Medicare Advantage plan to another one. You don't like the person, you don't like the insurance company, you just switch over. And you can add Part D prescription plan or cancel Part D prescription plan or switch to a different plan altogether. All these changes will be effective January 1st, as I showed you in the previous slide. Now let's talk about the open enrollment. This is the Medicare open enrollment, which is happening on from January 1st to March 31st. This is the Medicare Advantage open enrollment period. This is when you can go from one one-time change options. That is, you have currently a Medicare Advantage plan, you can go to a new Medicare Advantage plan. If you have a current Medicare Advantage plan, you can go to original Medicare. That is a traditional Medicare, which involves Medicare Part A, Part B, and Part D, plus maybe a supplemental insurance. Open enrollment period is between January 1st to March 31st. And I talked about all these different things you can do. Let's talk about the special enrollment period. Special enrollment period comes into play when you're working for an employee who is covering your insurance coverage, even though you are eligible for Medicare, and then you leave the work in the middle of the year. Now you have to switch over to traditional Medicare or take a Medicare Advantage plan. That's when you have a window of a few months to enroll into the traditional Medicare or Medicare Advantage plan from the time you leave your employer to sign up with these Medicare plans. And that's it also can change if your health coverage changes. For example, if someone gets kidney problem or if someone has a disability, that's when you will be able to use the special enrollment period to make sure there is no gap in your insurance coverage from your workplace or whatever the place you had the insurance to your continuation as a Medicare or Medicare Advantage plan. Why do we need to change our plan? I had it for 2 years. Everything is going fine. Yes, if everything is going fine, still I think it's worth listening to presentations like this. These are educational programs. This tells you the latest developments with Medicare and Medicare Advantage plans. There may be new features added by Medicare Advantage plans every year. So you are up to date with the plans and you can make an intelligent decision as what you need to do for the next year or the coming years. Your medications may change, your doctors may drop out of your provider list, your premiums and co-pays and out-of-pockets may be too much, and maybe there are other plans which have better options, or you move out of service, you leave Texas or you leave New York, you move to another state, and the plan may not carry to other states, then you have to get a new one. That becomes a special situation, special election period. Or a better alternative, Medicare Advantage first looks. Okay, Medicare Advantage, here's like, for example, an Oscar plan, which has an HMO plan, but it doesn't require any referrals, no medical or drug deductibles, no cost selection of insulin, unlimited transportation. So all these plans have certain advantages and perks. You need to go through each one of them and see which one best suits your particular requirements. Now let's look at some typical Medicare Advantage plans. Humana is one which has zero premium for HMO and some premium for people who select PPO, and they may also have copays when you're dealing with PPOs. You have copays in most types of insurances. For example, WellCare is an HMO plan with $95 rebate towards Part B premium. That's an advantage. Includes dental, vision, gym, and same thing with AARP. AARP also has a supplemental insurance for people who are on traditional Medicare Part A and Part B, and it has the insulin coverage, great network. AARP is nationwide, and competitive doctors and hospital copays. So there are a whole host of HMOs that are in the market. You just have to see which one best suits your requirements based on the things that I have talked about in the last several present minutes. The features of Medicare supplemental plans, previously known as MEDIGAP. I'm just going to give you a highlight of what to expect. As I said, MEDIGAP falls in this side of the equation. People who have traditional Medicare A and B, and this is a supplemental insurance to cover some of the deductibles, copays, and other things that were not covered by Medicare Part A and B. There are in addition to that, you also need to have a prescription plan to make a complete coverage of your Medicare requirements. And here are various plans listed as A, B, C, D, F, G, K, L, M, N. You can just pause the video and look at and see how much each one of these plans cover. The Cadillac plans are, of course, F and G, which covers 100% of your deductible and copay for Part A and Part B. It also covers excess Medicare Part B charges, and so some of these things. But of course, Plan G and F are going to be much more expensive compared to the other ones. Your total out-of-pocket cost will be something like $60 to $100 with these different plans. So these are all things you need to look at. If you're having traditional Medicare A, B, and a prescription plan to supplement the copay and other things, this is another plan you need to add. So as a result, you not only are paying your Part B premium, you also pay a premium for your supplemental insurance. You need to pay a premium for your prescription plan, so the costs can substantially add up. And if you can afford it, this is something you can look into. If you have a plan already, be it traditional Medicare with Medicare A, B, and some supplemental insurance company with prescription drug plan, or if you have a Medicare Advantage plan, we can look at your existing Medicare Advantage plan and see what are the plans that are available in the market today and what additional benefits they have, what are their copays, what are their deductibles, and how you can optimize your healthcare coverage, healthcare costs, and healthcare availability in terms of doctors and hospitals. So let us help you choose the best plan based on your needs. A few words about prescription drug plans. Prescription drug plans are an important part of making decision as to which plan you take and which prescription drug plan you take, because as I said, some drugs can cost $500 to $600, and especially if you are dealing with cancer drugs, they can cost several $1,000s a year, and they are all divided into different regions based on the states. The prescription drugs plans have a sort of a standardized schedule, like you have to first deductible each year $445. The initial drugs are covered, but in the form of a tier 1, tier 2, tier 3. That means you have copays depending upon whether it is a generic drug or brand name, or it is something like a cancer drug and things like that. And then you have a gap going from $41.30 to $61.50, where you pay a substantially increased copay, and you have a catastrophic coverage beyond $61.50, where most of the drugs are covered with a very small copay. So ladies and gentlemen, you need to look at your drugs. You talk to your pharmacist, you talk to your physician, and see what might change in the coming months or years, so you can choose wisely the prescription plan that meets your requirements. And here are some of the things about prescription plans. Should also look at some of these discount drug options available: Good RX or Savers, Scripts, Single Care. Sometimes Good RX may be cheaper than the copay you have to pay for getting your. Sometimes a Good RX price may be cheaper than the price you have to pay to get a 90-day supply of a certain medication. I have Kroger, and Kroger prices are actually cheaper than even Good RX on certain medications. So you need to shop around for your prescription drugs, and also all these various options available, discount pharmacy options available to minimize your prescription drug costs. This is a comprehensive overview of a Medicare Advantage plan. We are here to help you. This is Health Life 360. You can send us an email with your contact information and question. We'll be more than happy to get back with you. You can also visit our website healthlife360.com and fill out a query form. We will be happy to contact you and give you whatever information you need. You can also contact us through these telephone numbers. And thank you so much for your attention. Please do give us a call so we can help you.